Clint Wallace. You are just now getting off a very long overnight shift. How are you feeling right now?
Tired. It's a crazy. The hospital is kind of a crazy place these days. A lot going on. Has been going on for 8 months now. So pretty pretty tired. Ready
Yeah.
for bed.
And kind of talk to him about that with things being crazy. You mentioned ICU staff, they're stressed, tired. Tell me about that.
Well, yeah. Ever since the pandemic started back in, I think we got those patients from the Japanese cruise ship in late February, March. That's when our special pathogens unit opened at Sacred Heart. And ever since then, it's been pretty busy. I mean, we had at the beginning a lot of nurses were furloughed, a lot of staff was furloughed, and had to use their sick time and their vacation time at the beginning. But since they've kind of reopened everything, the elective surgeries, it's been very, very busy. And then through the summer, I think we kind of flattened the curve a little bit. But then as we've gotten into the colder weather, the fall, and after Halloween, we've seen a real big uptick on patients.
So what is that looking like as far as, well, so you mentioned a kind of a shift from the summer to the fall. What is your biggest concern right now as an ICU nurse?
Well, staff. My biggest concern is the amount of energy that our staff has spent on at the hospital, from the respiratory therapists to nurses to administration and the nursing assistants. We've all been working very hard, and when you bring in the COVID patient, they require even more work. They require constant monitoring. Of course, the changing of PPE to enter a room and to exit a room is taxing on us. And then we also are, of course, affected in our personal lives. All of us have been, had to deal with this, with our kids being at home and our spouses not having to be able to work, and all the stresses that everybody in the world's gone through on top of it. So it's just been an emotional time and a physically tiring time for all the staff at the hospital.
I think people forget that nurses, it's not okay, we go to the hospital, come home, call it a day. You also have families, right? You also are
Right.
living the same kind of chaos that is COVID outside of work.
Exactly. I have a senior in high school who's an athlete, and his best year of his life has almost been robbed from him, I believe, and it's been really difficult on him. And my daughter's a sophomore, and my wife's a clinical instructor at WSU, so it's just been hard on everybody. We're not the only ones for sure, but it's especially hard inside the hospital.
You mentioned COVID patients require a bit more attention, a bit more energy. Can you kind of specifically explain what that entails?
Sure. Just maintaining with every patient in the hospital, we maintain some precautions, right? Washing hands, trying to keep the rooms clean, trying to keep infections from being spread throughout the hospital. But when you introduce a virus that is the coronavirus and how contagious it is, we have to take extra precautions. And so it's putting on the PPE. At Sacred Heart, we wear the gloves. We do double glove. We wear a gown, a disposable gown, and also either some type of mask, whether it's a PAPR or an N95 and a face shield. So to put all that on, just to go into a room, takes some time. You spend the time with the patient, and then you want to go see another patient. You have to take all that off, leave the room, get your supplies, put all that back on, go into another room. So if I were to compare like a patient with pneumonia versus a patient with a COVID pneumonia, I would say the patient with a COVID pneumonia is probably 50 to 75% more work than the normal patient with pneumonia.
Would you say that's contributing to the bulk of just staff being so tired and stressed, or?
Yeah, yes, hospitals typically run, I don't have the exact statistics, but I bet you we run pretty much at 95% capacity all the time. I mean, I've been a nurse for 20 years, and I've been there's a national nurses shortage my whole career. Spokane isn't affected by the nursing shortage quite as much as the rest of the country because we have several nursing schools here in town, but we're always short staffed. And then you add a different population, the COVID population. It's just been taxing on everybody.
What would you say are maybe some of the most common complaints or concerns among ICU nurse staff?
Well, it's been very difficult because part of a patient's rehab, or even if it's their end of life, they need some family support. And with COVID, the ICU patients have not been able to get that, and that's been very difficult on staff to see patients alone, to not be able to visit with their family. We had visitors. They were allowed one visitor for a while there, but Sacred Heart, as of Monday, has stopped all visitors again at Sacred Heart, and that's really difficult on patients. It's part of someone healing or part of somebody dying, is to have that family support, and they don't have that. So to try and be that person as a nurse for the patient is emotionally difficult. So we continue to go, but we are pleading with the community that during this next lockdown phase that we can hopefully slow down this spread of the virus. It's been very concerning of how many patients we've gotten in the last couple of weeks.
So I have to ask, do you have an idea of how many patients you've lost to COVID so far?
I've seen a lot of death through my whole career, but this particular virus really can wipe somebody's life away pretty quickly. I know we've have some better treatments than we did 3 or 4 months ago, but unfortunately we've seen quite a little bit more death than normal.
Death is not something new to an ICU nurse, but you're seeing it more often.
Yeah, and it comes on quicker. You know, when we had those patients from the VA nursing home who were in a nursing home for a reason, they were kind of at their end, health-wise. But once they got the virus kind of spread through their facility, they had no chance at almost. Once they reached the ICU level of care, I don't think many of them survived. So the virus seems to really attack people who already have some sort of immunocompromised system, whether it's just age or whether it's diabetes, asthma. Those people are very vulnerable, and if their oxygen level gets to a certain demand, we rarely see them survive.
Would you say it's maybe too many to keep track of the number of patients, COVID patients you've lost?
I mean, I don't know how to quantify it. I mean, just last week we saw 10-ish, I'm not sure exactly, deaths, and that's a lot especially just for one virus. That's a substantial amount of people passing away. And unfortunately, we also see it within families or within friendships that it's clear that one of them gave it to the other person, whether it's the mother gave it to mother gave it to their daughter and they both got sick, or two friends who spent time together and they both have it. It's pretty obvious sometimes where they got the virus, and that's really hard.
Well, that can't be easy, because at the end of the day, you're still human.
Exactly. Like I said, I've been a nurse for a long time and I've seen a lot of death, and so I've kind of joke about how it's tough to be compassionate sometimes because it happens so frequently. But I've even been impressed of how difficult it has been, even though I sometimes question whether I have much compassion.
Do you see just the increased just seeing this happen more frequently, people dying from this virus? Do you think it's having an effect on all of ICU staff? Do you see kind of a change in folks? Like you said,
No.
it's not something new, but seeing it so frequently, I wonder if it's had any vivid effects on folks.
Absolutely. We are, as a whole, and I'm sure I can represent them all, that we are exhausted, we are tired, we are near burnout, if not already burnt out. It's been that difficult these last 8 months.
And you mentioned, so you were part of Governor Jay Inslee's speech on Sunday. It was great to see some Spokane representation there. You talked about the unused vacation time or used vacation time. You kind of talk about just the demand for hospital staff right now. Is it such a high demand that, there's really no norm for staff?
Right. So, at the beginning of the pandemic, a lot of nurses, it kind of depends what kind of nurse you are, what kind of, or where you work in the hospital. They shut down a big portion of the hospital and asked those nurses and staff to stay home. And a lot of them used their vacation time, without vacation. I mean, they didn't have to work, but they still used those hours or used their sick time if they were exposed to COVID. And that was 8 months ago. And so, we don't have an infinite amount of those hours. Nobody does. And so we've had to use all those hours. And now we get to a point where a lot of staff and a lot of nurses don't have any sick time or vacation time. And, that's kind of, and we, because they use it all just by staying home, homeschooling, for example. It's been difficult for everybody. We understand. Everybody's been in the world has been affected by this, but I know the staff at the hospital have to really struggle through this pandemic.
Did you ever think that it would go for this long? You'd be so exhausted and tired for so long? I mean, 8 months, right?
8 months and no end in sight. That's the difficult part. It's not like we can, it's not like we know when this is going to end. In fact, I think most of us assume with Thanksgiving coming up and holidays and the cold weather, not that the cold weather affects the virus, but the cold weather makes people want to be indoors more. If we don't act differently, we are going to see some really bad situations everywhere in the country, and including Spokane.
And that was mentioned by the state or the Department of Health on Sunday that we could see double the number of cases by next week if we continue with the trend that we're seeing. Do you think locally that could be the case? We could just double and just altogether overwhelm the hospital if we kept at it? For
sure. I don't think there's any question. I think we're anticipating that will happen. It's an interesting thing about this virus, that this is something that we can control. This isn't like a flood or an earthquake that we have no control of. If we as a community did come together and all follow the guidelines of the health experts, we would be able to control this virus. I know that's very difficult. I know that's asking a lot, but I sometimes, in the back of my mind, hope with my optimistic hopes that we can flatten this curve, that we can get through this this pandemic with not having to put so much, not having so many people pass away, and not having to put so much efforts into the hospital.
Kind of leads me to my into one of my other questions later on, but I guess it's obvious that there are quite a few people that aren't happy or disagree with the new restrictions. So what would you say to those people?
Well, I feel the pain. I understand. Like I said, I have kids that are in high school, and they've been everything's been taken away from them, and I understand that all the businesses are struggling. A lot of businesses are struggling. I understand that, but this is something that's unprecedented. It's something that we can control. And I would hope that as a community that, especially after the elections, it's done, let's just focus on our community and each other, and we can get through this. I have a hard time sometimes with people who will go to a physician, go to a doctor, and the doctor will say, take this medicine for this. And they'll say, no problem, I'll do it, doc. Or you need this therapy. And the people will say, no problem, doc. But when a doctor says, you should stay home with your family and not, and do as much social distancing, or not go to groups, or not perform, not do activities that the virus can be contagious. People say, oh, I'm not going to do that. Well, it's the same doctor giving the same advice, giving advice with this same background, but for some reason, this has become a political decision, and I don't understand the disconnect, because it shouldn't be a political decision. It shouldn't be anything other than I'm going to do what the doctors and the scientists say to do.
I wonder if just to kind of give us a better grasp, because I feel like people don't really understand just how this pandemic is affecting our hospitals. Kind of give a better perspective of what struggles you guys are facing. So it sounded like on Sunday that the real, not only to save lives, but one of the goals at these restrictions was to really prevent from further overwhelming our hospital staff. So I wonder, can you kind of explain maybe how are interactions among staff, or I guess, I mean, if you're exhausted, I can only imagine maybe the interactions with staff, even on a good day,
Yeah,
may not be easy. But I guess just kind of what is a typical day like? Maybe what was your last shift like, as far as just kind of that day-to-day stress and exhaustion that you all have been experiencing?
Yeah, I will give a big shout out to all my colleagues at the hospital, that we have done, I believe, an amazing job considering the circumstances. That said, we all know it. We are exhausted. We're tired. We need help. We see the writing on the walls of what's about to come, and I think it concerns everybody who works at the hospital. Whether I know my employees, or the employees the employees of the hospital are. So I think some of them want to just scream out of the top of their heads, like, what is going on? Why can't we just stop this? And but most of us are, trying to understand that some people just don't want to follow these guidelines for whatever reason, and it's hard to fathom. I wish people understood how busy hospitals were. The hospitals are in this business to make money, just like everybody, and so they run at a pretty thin level of capacity. They run at a pretty high capacity all the time, and so just to add all the stress, all the emotions, all the labor on top of the normal hospital life, it's been very, very difficult. And we could only hope that this doesn't continue, this rise doesn't continue. I think a lot of staff members have worked a ton of overtime. I just finished my second 16-hour shift, and last night I had 2 patients who were COVID positive in the ICU. One of them will survive, one of them won't. And it's difficult to see, especially the one who won't. And I'm talking to their family member on the phone and trying to FaceTime with the patient who's unconscious in an induced coma, but trying to, show the family this is what's going on. I will also add that these COVID patients who get to the ICU level, at least that are really severely ill, critically ill, we do some, we do what we call proning, which just means we put them on their belly while they're intubated, while they're on the ventilator. We put them on their belly. It's shown to help, and it has improved a lot of our patients. But it's a very, if someone from the outside were to see what we do inside those rooms to these patients, throwing them, flipping them on their belly, and it's a strange time. That's a therapy that we rarely see in the ICU, but with COVID patients, we're doing it pretty common.
A lot there.
A lot there. I know. I'm sorry.
No, it's okay.
I'm tired. That's how I start to ramble. I'm like, what am
No,
I
you're
talking about? I say
good. No,
things.
that you hit it right on the head. No, definitely. I'm not sure if I have any other questions. I guess. Do you feel like you've been have staff received adequate support? I mean, outside of kind of the community factor of helping stop the spread, but do staff feel supported as we kind of continue through this?
Yes and no. I mean, I think Providence and Sacred Heart have done an adequate job of keeping the staff safe. We will always have our disagreements of how much they could do and how much they actually do for us. But I think in general, I think the hospital has supported the staff quite well. And I think the joke is among staff that as nurses, we were heroes for like 3 weeks. It was a lot of fun for those three. We were always congratulated, and a lot of gratitude was given our way, which was kind of nice. But that was back in March, and as it's worn on, everybody's just gotten more tired, and it stinks for everybody involved. It stinks. Everybody in the world is being affected by this. And so I think the community as a whole, I think Spokane as a whole is done pretty well. I mean, I don't go many places and not see somebody wearing a mask. And I know for those first few months too, going to work, I'd go down Division and I could just tell that the traffic was much lighter. But as we've gotten more used to it, as we've gotten more used to the pandemic, I think people have kind of relaxed their habits of trying to keep socially distanced and to try to keep this virus down or keep it away until we can at least get a vaccine or something. So again, we're just very concerned with what's happening now, because in the last few weeks, we've seen a huge increase of COVID positive patients at the hospital, and that's Sacred Heart, and that's only in Spokane. We've pretty much stopped accepting patients from other parts of the state, which is not normal for Sacred Heart because we're kind of the big dog in the state, or at least this side of the state. And so we get a lot of transfer patients from other hospitals, but because of our capacity, we've had to stop doing that.
I did want to ask, throughout the day, do you find you're constantly on your feet? Do you ever get a moment for a break or anything like that?
Well, yes, I think yes. I mean, it's nurses' responsibility a lot of times to find some time, but we're like everybody else in the world. It's hard to take a break because we can't go into a break room because there's small rooms, and there's once one or two people in there, it's hard to keep your distance. So it's difficult especially on night shift. What do you do on break? Day shift, sometimes you can at least go outside, and especially in the warm weather, but not the cold weather. So that's a big part of this, I think, is just finding some downtime, finding somewhere to go, somewhere to relax, but also keeping with the rules of social distancing and stuff. And no
So
one's
there,
comfortable in a mask. We wear a
yeah,
mask.
right.
I wear a mask 23 hours a day, and it's still not comfortable. I hate it, but we all do it. We have to do it.
Was there anything else you'd like to add? I did hope that maybe I could get a comment from you about being part of Sunday's announcement from the governor's office. What was that like, being a voice to the whole state?
Yeah, I've been I'm an officer with the nurses union, and so I've spoken with the governor and a few times, but I had no idea going into that how that press conference was going to be broadcast. Even my son, who was watching football, ran into the room where I was being interviewed and said, "Dad, you're on TV." And I'm like, "I am." I had no idea it was going to be so big. So it's been very nice, and I will say that the gratitude from so many people around, and that those videos have gone throughout a lot of parts of the country, and I've heard from a lot of people, throughout the country. I was even quoted in the Washington Post yesterday. It's my 15 minutes of fame. I said, my quote was, "We're exhausted," which I think is very fitting. That's what's going to say on my tombstone. Clint was tired.
A down the road tombstone, right?
Yeah, yeah,
Washington
yeah.
Post, though, that's cool. That's so
Yeah, I
awesome.
know.
Do you
I'm a big
think the
deal.
people, do you think the people here in Washington and those who heard it elsewhere, do you think they heard your message? I mean, you said, hey, we are exhausted. We need to come together and be a community and follow these guidelines.
I don't know. Time will tell. Well, I hope so. I really hope that as a community, as a state, that we can put aside our differences and focus on being a community, and that we can follow these guidelines and just get through this together. And but it's going to it takes a lot. There's so many emotions going on right now with elections and with social justice and a lot of different topics. I know everybody is pent up, and we have so many emotions, but if I really hope that they can hear the message of doing what the health experts ask and getting through these few months, and then we will move forward.
To kind of close out, I think that hits on a good note, but I wanted to ask, with all of this chaos that's going on, what keeps you going every day? I mean, what continues to keep you motivated to get up and get to work and stay up and come home at 7, 8 o'clock to see your family get ready? I mean, what motivating thoughts? What do you look to keep going?
I mean, it's what I do. I don't. It's I've been a nurse for a long time, and it's one of my passions. Um, I feel as a nurse that we are an important part of the community, and I take pride in that. I take pride in the people I work with, and um, I know it's difficult, but it's a job. I know I'm very lucky to have a job that needs me all the time during these difficult times. So we keep going. We just hope it ends soon.
Do you look to kind of your passion as a nurse, your family? I mean, what inspires you to get out of bed in the morning?
Well, I got to pay for their college.
Right.
um, um, I have a great family. I have a great kids that always keep me inspired, and my wife, and I have a wonderful support network that who are mostly nurses who we've stayed together via text and at work and bonded, and so having that important support system has been life saving, literally, for me.